Hello, everyone. My name is Ben Dunham, and today I'll be going over the novel rat pain scale we developed, as well as applying it to opioid-induced hyperalgesia. So measuring pain is a very difficult thing to do both in animals and in humans. Here you can see a pain scale used in humans that's really oversimplified and doesn't capture the complex experience of pain. Most animal models rely exclusively upon reflexive withdrawal response. Usually this is a binary system where either they respond or they do not. Some models do also use an affective component such as facial grimace. Our system incorporates both of these things to generate a PCA score, a principal component analysis, so that we get one number out of all of these things put together. Here you can see how we gathered our data. We have the rat in a behavior box being recorded by a high-speed camera at 2,000 frames per second, and we look at the paw kinematics inside of a program that lets us look at the high-speed footage. They received both noxious and innocuous stimuli, and here you can see examples of PCA scores. So anything above a 0 up to a 4 is considered a painful stimuli. Anything below a 0 down to a -4 is considered a non-painful stimuli. This animal model was developed based on a model developed by Dr. Abdus-Saboor and Dr. Frey in mice. Here are some of the behavioral components that we are measuring. So eye grimace or orbital tightening, paw shaking, jumping, and paw guarding. And here we have some of the reflexive components we're measuring. So we have the distance that the animal withdraws its paw from the bottom of the cage, as well as the speed it withdraws its paw. So a more painful stimuli will be withdrawn farther. A non-painful stimuli will have a lesser withdrawal. Here you can see a direct comparison between the two. So all of this is put together to create that score that I mentioned earlier. So here's a proof of concept showing that we can discern between painful and non-painful stimuli, both in log animals and sprague-dowly rats in males and females. The CS and DB are cut and swab and dynamic brush respectively. Those are our non-painful stimuli, while LP and HP are light poke and heavy poke. So the light poke and heavy poke are noxious. CS and DB are innocuous. You can see that the innocuous stimuli are in the non-pain domain and the noxious stimuli are in the pain domain. Something really strange that we found in the course of our research is that von Frey hairs do not appear to be painful to rats, which is rather strange. Von Frey hairs are these little hammer-like things that have a metal pin coming out of them that bends under a certain amount of pressure. Here you can see the different levels of pressure you need: 10 grams, 100 grams, 300 grams to bend the pin. These are used to induce pain in a lot of different types of pain research. And it's rather strange we didn't see a painful response here. And it suggests that perhaps von Frey hairs are not the stalwart measure of pain that we believe them to be. Opioid-induced hyperalgesia is defined by the National Institute of Health as a heightened sense of pain sensitivity due to long-term use of opioids. Here is our timeline showing how we tested and what the animals received. So at baseline, they were tested, abstinence day 1 and abstinence day 7, they were tested, and they had 10 days to self-administer either morphine or sucrose. We used an IVSA model, which is different than almost all the previous literature on opioid-induced hyperalgesia. Opioid-induced hyperalgesia is a very controversial topic in literature in general, and almost all the research is done in mice, and it is also almost exclusively done using minipumps or capsules. We believe IVSA to be a better way to measure this sort of thing, as it is an intermittent schedule as opposed to a continuous one. Here you can see the data that we gathered. So we have cotton swab as our non-painful stimuli, then von Frey's, which as I said previously, are found to be non-painful, and then our two noxious stimuli here. We did not see the presence of opioid-induced hyperalgesia in our sample. The previous literature indicated that it should be most apparent at day 1 of abstinence, and we did not see it in the noxious or innocuous stimuli, which is rather strange. So it looks like in our sample, we did not see the presence of opioid-induced hyperalgesia, which suggests that perhaps there needs to be more research to either confirm or deny its existence. So in conclusion, opioid-induced hyperalgesia was not discovered in our research. Von Frey hairs may not be the stalwart tool that we believe them to be, and more researchers really need to verify the findings, particularly in the opioid-induced hyperalgesia, to make sure that it either is or is not a real phenomenon. And here's an acknowledgement slide, just thanking everybody that was a part of this project. Thank you all for your time.